I hope it's videoing. Alright, so I'm presenting my final project in my senior class on combating alarm fatigue. My name is Hannah Ward and I'm presenting to two of my co-workers. Alright, so alarm fatigue is the dilemma of alarm desensitization in nurses and other healthcare professionals, and it's threatening the safety of our patients. So the purpose of this project is to provide evidence-based recommendations to better manage clinical alarm systems in the hospital setting. So clinical alarm systems are necessary in the hospital setting in order to alert clinicians of a change in patient status. This day and time, with the nursing shortage and the need for healthcare rising, clinical alarm systems in the hospital are a necessity. Could you imagine working on IMCU 4th floor with 4 to 5 patients and not having any alarm equipped devices to let you know that your patient's in a critical condition? No, I couldn't, but when alarm systems are working properly, the quality of patient care is improved. However, patient safety is put at risk when clinical alarm systems are continuously giving us false alarms. These false alarms can cause distraction for nurses. They can be an annoyance to the nurses and the patients and the families. And they can cause nurses to become so desensitized to the point where they don't even hear the alarms, even if they are critical. So currently there is no universal standardized policy to identify to properly manage clinical alarms. Proper management and education on alarms in the clinical setting will make healthcare professionals more sensitive to critical alarms and be more able to provide better care to our patients. So, the ultimate goal is to improve the safety of clinical alarm systems in the hospital setting. By presenting this project, I hope to bring awareness to the dilemma of alarm fatigue and provide recommendations for more education and proper management of the alarm systems. So my rationale for the project, in 2013, the Joint Commission issued a Sentinel event alert on alarm fatigue because it has become such a nationwide problem. They did a study, and within 3 years, 98 alarm-related events occurred. 5 of those events were resulted in unexpected additional care for the patient. 13 resulted in permanent loss of function, and 80 of those events resulted in death. So, as of January 2018, the Joint Commission recognized the need to reduce the harm associated with clinical alarm systems as a hospital national patient safety goal. So I believe if more awareness is brought to this dilemma, then deaths or serious injuries caused by desensitization can be eliminated. Some of the root causes for false alarms are inadequate training of staff, inappropriate parameter settings of the devices, default settings that are not changed to meet each individual patient's needs, and misuse of sensors or electrodes. So my PICO question for the project is, how do increased educational interventions and enforced policies on proper management of clinical alarm systems reduce alarm fatigue compared to our current interventions? So I did research on 3 different nursing articles. The first research article was performed to gain knowledge of the impact of a safety huddle-based intervention on monitor alarm rates. The conclusion from this research article was that the safety huddle-based alarm discussions among nurses before and after each shift proved to be a safe and effective approach in reducing alarms for individual patients. Nurses also say in these team huddles, it gives them time to discuss each patient's status and devise a plan on how they're going to monitor each device for each patient, so they can all kind of combine ideas during this time. The second research article is an interventional study that was performed to examine the effectiveness of monitor customization software that was put into their clinical devices. This software helped to customize the alarm settings for each individual patient, and the results of this study showed a reduction of clinical alarms, and nurses reported spending less time on false alarms, which gave them more time to focus on important alarms and improve patient safety. And my third article was a study done. They made a standardized cardiac monitor process, and then they implemented it onto their unit. So the goal was to implement the process as a standard in order to decrease the number of false alarms. So when they implemented this process, they changed 4 different things. They made sure there's an initial order on the charts and setting of monitor parameters based on the age-appropriate standards. They replaced the electrodes and sensors on the patients daily, and they made individualized assessments of the cardiac monitor parameters daily for each patient. And they appropriately discontinued the cardiac monitors when they're no longer needed on the patients. So the changes they made through this implementation of this process resulted in a significant decrease in cardiac monitor alarms. So my recommendations for the project is to require mandatory educational classes on proper management of alarm-equipped devices to all clinical staff that are directly involved in patient care. Have nurses participate in safety huddle-based meetings before and after each shift to collaborate all your ideas together. And a third recommendation is to implement a standardized monitor process. Make sure we have the orders that we need for the parameters. And also have unit managers or hospital administrators write policies on the proper maintenance of clinical alarm systems. So in order for these changes to take place, this project should be presented to the unit managers and the hospital administration. Ways to evaluate changes that have made if this project were to get implemented. So success of this project will be based on a decreased number of alarms after the project is implemented. The number of alarms per shift will need to be evaluated before and after the project, and then post-interventional counts of the alarms will need to be done 2 to 3 months after implementation is what I set my goal as. And then nursing sensitivity to like how they feel about the alarms and the system and the processes can be measured through a hospital-wide survey before and after the project is implemented. And clinical staff should be evaluated on their knowledge of how they manage clinical alarm systems. So my expected outcome, evidence has proven that the recommendations mentioned have decreased alarms in the clinical setting. So decreasing the number of alarms will reduce alarm fatigue and allow nurses to provide higher quality care to their patients with less distractions. And in conclusion, I hope more awareness has been brought to the problem of alarm fatigue. I hope to implement a plan to decrease alarm fatigue in this clinical setting so that we can provide better patient care. And those are my references. Any questions? Alright, thank y'all.